heart of Singapore, a city of dazzling lights and bustling streets, there exists a hidden world, a community shrouded in secrecy and burdened with unspoken struggles. Amidst this rich tapestry of diverse cultures, thousands of individuals, often migrants seeking a brighter future, find themselves working as sex workers. Their stories are marked by resilience, sacrifice, and a yearning for survival. This is Geylang, Singapore's red light district. Along the quiet streets, each brothel houses a few of the approximately 10,000 sex workers living here.
Sex workers are defined as individuals who engage in sexual or intimate labor in exchange for financial remuneration. Only a small fraction, less than 10% of these sex workers in Singapore, are regulated and licensed to work in brothels. Upon their arrival, they sign contracts with the police and are issued yellow cards, affirming the legality of their work and granting them certain healthcare benefits. On the other hand, the remaining 90% of migrant sex workers operate in the shadows of illegality, entering Singapore on social passes visa-free. Under the facade of being regular workers, they discreetly engage in solicitation for income, which allows them to evade registration requirements. While they have the freedom to engage in various forms of work, they live under constant threat of arrest and prosecution. The clandestine nature of their profession denies these sex workers access to crucial health services. Their hesitance to access healthcare services and undergo routine checkups indicates a lack of primary preventive care, leaving them susceptible to numerous chronic non-communicable diseases. The neglect of their sexual and general health not only puts these sex workers at greater risk of developing both sexual and non-sexual chronic diseases, but also poses a potential danger to the wider community. But what exactly are these barriers that impede their access to healthcare? Let's delve deeper into this. First, they grapple with the haunting fear of identity exposure. Engaging in sex work outside the registered brothel scheme is illegal, placing them at risk of deportation. To avoid legal repercussions and societal judgment, they remain hidden in the shadows, reluctant to seek medical assistance. Furthermore, the oppressive weight of societal stigma and discrimination from society bears down upon them. Besides facing prejudice from the public, healthcare providers sometimes perpetuate this discrimination as well. This hostile environment fosters a sense of mistrust and reluctance to seek medical help, which ultimately leads to poor health outcomes.
So, what has been done so far to alleviate this problem?
Support networks and non-profit organizations such as Project X and Action for AIDS strive to empower these individuals and dismantle the barriers they encounter through the provision of social, legal, and monetary support and the establishment of anonymous mobile testing sites for accessible HIV and STD testing. Despite the commendable efforts of current interventions, instances have arisen where sex workers exhibit hesitancy in approaching the anonymous mobile vans stemming from their fear that authorities may observe their interaction with the van and interpret it as grounds for their arrest. Moreover, there is an overemphasis in the focus on sexual health, with inadequate attention given to general health and non-sexual chronic diseases. Despite efforts to reduce stigma, it is the fear of encountering discrimination from healthcare professionals that continues to hinder sex workers from seeking essential healthcare. Therefore, it is imperative to expand interventions that not only prioritize anonymity, but also encompass the broader spectrum of healthcare needs and challenges faced by sex workers.
With this in mind, we present Sakura Care, a three-pronged approach consisting of Sakura Telemed, Sakura Talks, and Sakura She, which represents sex workers' harmony and empowerment. Through this project, we strive to lower the barriers to health faced by sex workers in Singapore by increasing accessibility to care, tackling the discrimination they face from healthcare providers, and encouraging health-seeking behaviors among sex workers.
Sakura Telemed is anchored in the use of telemedicine specifically tailored to sex workers. Telemedicine have emerged as a promising approach in delivering remote healthcare services in recent years, which is crucial given the ad hoc and unpredictable nature of sex workers' work and personal schedules. Helmed by specialized healthcare professionals, Sakura Telemed will help to create a platform for sex workers to seek comprehensive healthcare services that goes beyond just sexual health. Through regular checkups and consultations, they will play a crucial role in promoting preventative care, offering personalized advice, and encouraging the adoption of healthier lifestyle behaviors. To safeguard patient confidentiality and foster a secure environment for open communication, Sakura Telemed intends to establish anonymous consultations via Zoom. This approach eliminates the need for sex workers to provide personal details, granting them greater assurance when accessing healthcare services. By prioritizing anonymity, we strive to build a strong sense of trust between healthcare professionals and sex workers, allowing for candid discussions and ensuring their safety throughout the consultation process. This enhances the accessibility of healthcare for sex workers, empowering them to seek the vital care they urgently require.
Secondly, Sakura Talks entails the organization of online fireside chats throughout the year to provide an engaging platform for healthcare providers to understand and learn more about the challenges that sex workers face when seeking healthcare treatment. Sakura Talks will be held 3 times a year online to facilitate accessibility and convenience to connect with healthcare providers throughout the country. Public health experts will be invited to share their insights and recommendations directly with healthcare providers in a conversational manner. At the same time, any questions or concerns from the healthcare providers can be directly addressed through Q&A sessions incorporated into the fireside chats. Additionally, sex worker advocates will be invited as guest speakers to share the various experiences of the sex workers they have worked with. By allowing them to gain a more nuanced perspective, this can facilitate conversations that humanize sex workers and provide empathy, which is a more compassionate and non-judgmental approach. This dialogue creates a more inclusive and non-stigmatizing healthcare environment for sex workers when they come to receive healthcare treatment. Extensive research reveals that individuals engaged in sex works often harbor mistrust towards healthcare professionals, consequently refraining from seeking their assistance. However, studies have demonstrated that these individuals are more inclined to place their trust in peers who share similar experiences. In light of this, we propose Sakura She, a community-based testing program specifically designed to enhance the engagement of informal sex workers in accessing crucial comprehensive testing services. This initiative aims to leverage the power of peer support, creating a conducive environment wherein these individuals feel empowered to seek and receive the necessary healthcare they require. Sex workers who are identified as peer leaders will be trained by healthcare providers to provide basic testing services such as HIV/STD tests, hypertension and diabetes tests, and case management support to sex workers at their place of employment. They may also provide encouragement to their fellow sex workers to get tested for HIV/STDs if they are suspected to be at risk at work. This peer support intervention will work in conjunction with Sakura Telemed, where suspected cases are referred to the healthcare providers for follow-up diagnosis and treatment. Overall, sex workers will become more empowered to take control of their own health and well-being by fostering a safe and non-stigmatizing environment. These peer leaders will be rewarded with a stipend of $490 a month to continually engage with their peers beyond the rollout of the program.
So how do we justify the solutions covered in Sakura Care?
Our project will be grounded in the COM-B model as a framework for justification. The combined efforts of Sakura Talks and Sakura She enhances the physical capabilities of both healthcare providers and trained peer leaders by imparting knowledge, improving access to, and emboldening utilization of healthcare services among sex workers. Additionally, Sakura Talks promotes empathy among healthcare providers, reducing bias in their interaction with sex workers and boosting their psychological capabilities. The peer leaders and supportive sex worker community creates a social opportunity that empowers individuals to take charge of their own health, while also increasing the reflective motivation for seeking healthcare when needed. Sakura Telemed further leverages physical opportunities by allowing online medical consultations, breaking down the barriers sex workers face in accessing professional healthcare clinics. As a result, the 3 interventions under Sakura Care collectively motivate sex workers to seek and utilize healthcare treatments, resulting in improved mental and physical well-being. This positive change further reinforces the adoption of such behaviors in other sex workers within the community, creating a ripple effect.
Moving on, this will be our proposed timeline for Sakura Care, in which we have decided to divide into each of our interventions in a Gantt chart format. The interventions are planned to run over the course of 4 years, during which there will be a total of 6 major phases, each lasting 3 months. Reviews and evaluations of our interventions will be interspersed yearly throughout the 4 years to ensure program effectiveness and to implement necessary modifications. Here is a rough breakdown of our budget.
Moving forward with our project, we hope to expand the reach of Sakura Care across the island with the support of funding from the government and dedicated foundations. Establishing a strong community of peer supporters also empowers sex workers to take charge of their own health and legal rights, which are vital in reducing stigma, discrimination, and violence against them. By encouraging a sense of solidarity and advocacy, we hope to work towards the implementation of reforms that protect the well-being of sex workers. Overall, our project aims to reduce the perceived stigma among sex work and create an environment where sex workers are confident and comfortable to seek healthcare treatment in the local hospital.